There's a new financial empowerment center located in the Wayne County Treasurer's Office on the 5th floor of 400 Monroe in Detroit.
If you or someone you know needs help with their finances, budgeting, and making monthly payments, the Detroit Financial Empowerment Center can help.
Wayne Metro Community Action Agency has counselors ready to provide free one-on-one counseling to help you address issues related to utility bills, taxes, and other financial matters. We can also help you improve your credit score.
Well, good morning, everyone. This is Friday, the 29th of January. If you were looking once again for the weekly broadcast of the Ask Welfare Rights Program, you've been successful and you found us, and I'm saying us, even though Marion is just about in the parking lot. On our way here, we've already had our consultation for the morning. And I'm here, and always, even if I'm a little late or she's a little late, in spirit, we are here together. This is the weekly broadcast of the Ask Welfare Rights Program. And what we try to do is to answer questions or provide information about things that may be important to the community that we live in. And when I say community, I don't mean just people of color. I'm talking about working class people. Doesn't matter what you look like, but if you work for a living, there's a level of challenge and a level of struggle in your life 24/7. So we're once again here and have a few historical items that I wanted to present. Before I do that, let me read what Marion generally reads. The call-in numbers, should you want to call in and share some information, they're listed at the bottom of the screen. It's always the area code 313-868-4336 or 868-0351 or 313-868-0342. We are at 166 Victor in Highland Park, just 1, 2, 3 blocks north of Davison and right off of Woodward in Highland Park. And I say that because I know that during this COVID period, a lot of things are changing. This radio station, WHPR, is always in need of community contributions. So things have not changed here either. If you're on the website and able to get to your computer, you can get us this morning, and this is a live broadcast on a Friday morning at 10 o'clock. And the website is www.tv33whpr.com. I'll say it again, www.tv33whpr.com. So it looks like there's a fanfare and a drum roll and the trumpets are bugling. And yes, there's Marion Kramer coming in. All right, and if Tim hadn't mentioned it to us, she would be walking across the camera just seconds ago. So he had to remind her, no, don't walk that way, walk this way. So this is, again, the weekly broadcast of the Ask Welfare Rights Program, and it is 18 degrees outside. Hallelujah. It is cold out there today, Jack. Going to talk a little bit today about some historical things that, we only have 1 or 2 more days for the end of this month. Thank you so very much. Tim just brought over the tissues because, our noses are constantly in trouble. And we're almost in Black History Month. Just another few days and it'll be February. And I was thinking that maybe Marion and I might be able to get a jump on Black History Month. And we got so many things that are going on. So many things. The attacks against democracy, the democracy, a little bit that we had, and what we thought we had is under attack. Everything is different here these days. So we've got people running into the Capitol building and tearing up stuff and threatening people. Nancy Pelosi was one of the victims that people said we need to put a bullet in her head. Oh, goodness. A obvious threat, a very clear one. And then yesterday, day before yesterday, Speaker of the House Nancy Pelosi was on TV talking about the enemy is within us. The enemy is in the house. And when the reporters asked her, what are you talking about? She said they are members of the House of Representatives, where she presides over, carry guns and threaten other House members. And that's, we're exposing something. Whatever it is that the United States of America is and what we all thought she was is turning into something else. And Maya Angelou, very good with that kind of comment. And when a person or country tells you or shows you who they are, you should believe them. And so I think we've got enough information to believe that what many of us have suspected and have witnessed over the years is in fact what's going on. Violent place. Who, Lord? And those of us that are still alive, let's thank God for that. And I know that Malik Shabazz and others, Theo, are on the broadcast. And what they generally talk about, Mary, leave that thing alone. Mary, don't go back down there. Oh, Lord, she's still picking up this cane that has fallen 6 times already today. Alrighty, wherever you put it, don't matter. Ain't nobody else going to be in here but me and you and Tim. Please be careful. Lordy. All right, I got it out of the gap for you. Okay, so you're not falling in the hole. So we've got these tremendous pieces of evidence that indicate how bad and how violent this country can be, even though they beat the one guy on the 6th of January, beat him with a flagpole that says Blue Lives Matter. And that was an homage, that was a support for the police. And that's what the message means, Blue Lives Matter. And so folks that believe in the police department took a flagpole and beat this man and stunned this man and stabbed this man and kicked this man and assaulted this man. He's already had a heart attack. And I heard a couple of days ago, it looks like he had a stroke as well. And these are people that say they love America and they love police. And the wrestling star John Cena, I remember the first time I heard it when he said it, if you're going to love America, you have to love all Americans. So these guys apparently didn't get the message. And the House of Republicans have carried on this hateful situation. You going to leave your mask on today? Oh, okay. All right. And going to, they haven't forgotten too much in terms of what happened just the other day, but they're carrying on a circumstance where they don't want to hold anybody responsible for what happened. So then the other thing, I talked to Marion this morning, and she's here now, and we just found out that Cicely Tyson joined the Ancestors. And that was a blow. That kind of struck my heart. You know, so many of us, women in particular, have been admirers and supporters of Cicely Tyson, the great actress, for a long time. And the movie Sounder and Roots, when that came out, and she was in that. She was Kunta Kinte's mom. And I was thinking about the autobiography of Miss Jane Pittman, how wonderful that was. And one of my favorites is a movie called Hoodlum with Larry Fishburne and Cicely Tyson, set in the days of what do you call that, ragtime. And she ran, her character was in charge of running numbers, and how beautiful she was. And, you know, what a history, 96 years old. and just a loss. Didn't know her personally, but you have sort of a pain in your chest when you hear about this kind of thing, and a couple of tears come to your eyes. So apparently the tributes have been running in and falling in as a pioneer that she was over decades of acting and number of awards received and whatnot. And it's really, the world changed when the ancestors came and got Miss Cicely Tyson. So, Marion, we're going to ask you this morning to describe a little bit of what you are wearing today. So, come a little closer to the microphone so we'll be able to hear you. So, now what is that you have on your face this morning, Marion? What is that?
GBI, which represents the General Baker Institute, as well as that's the place where welfare rights have space and everything. So, one of the things that Carolyn has done is made these GPI, whatever it is. I can't see it.
GBI. But I think you know what it is. It looks like it's upside down.
It might be.
I think it is, because the eye is supposed to be, turn on the other way. The eye's supposed to be on the other end.
No, when I first came in, I had on two
masks?
Yeah, because you can't
hold it up, though.
You cannot be.
Hold it up so people can see it.
Let me get the thing right. There it is.
No, it's not. You got it upside down.
I still had it upside down.
Yeah.
Oh, there it is.
Yeah. GBI, and that stands for
General Baker Institute.
There you go.
And the place. One of the tasks they carry out there is to be able to print for people, their various invitations and stuff like that.
Flyers and stuff.
Like that, and look into it, and if you need some printing done, give GBI a call, or call one of us, and we can connect you up with them. All right.
Now I'm gonna say this.
Kleenex, please.
I'll put it over here.
Share.
So
I think you gave it to
Would you
both
like
of them.
another one?
Well, yeah.
Let's take another
Thank
one.
you.
Yeah. All right. Now, nose are running. Okay. All right. But we good. We good.
Takes care of us.
I was telling Tim this morning how bad I was feeling, and prayerful that our beautician is
my
feeling
God, yeah.
better. Our beautician, we reached her the other day, and she let us know that she's in quarantine because she had been infected with the COVID virus and was feeling a little sick. And I haven't talked to her in a few days now, and I probably need to call her later on today, and I will, just to check on her. But look at how frightening that is, And I say that because now, Marion, I guess we better have a conversation about who's scared of taking the vaccine and who's not.
One
better
thing,
say
man,
something about that.
Gracie didn't call in?
Not yet. No, we're just getting started.
Okay, because she was supposed to call in at 10:30. I mean 10:10 or something like that. But
Vaccine.
the vaccine.
People are afraid to take it. I heard the
But
other
that's
day.
that just didn't start with this vaccine. It's been years in history of this type of stuff. Whether or not you're going to give your child a vaccine for polio and all that type of stuff, and and people become, particularly low-income people and particularly black folks, we have a history of that, and had problems with, your parents had problems with it, so therefore they think all vaccines are bad. Listen.
Yeah, let's talk about this one.
The thing about when I agree so hardly on the fact that what the scientist says, you got to look and find out about the vaccine and see. I took it. Maureen had to call me. I was in the middle of a meeting, and my thing was, I'll get down there soon. And so, get out
I
of
said,
here.
no, you got to
She's on
come
the phone
now.
now, and I am happy that I went.
But let's talk about this.
And, we don't know.
Conspiracy theories.
Marie, who would put a conspiracy theory out there? It's like being in Louisiana and people be talking about let's go get our mojo on and all that type of stuff. Look, folks, use your brains.
Well, let's unwind this.
I mean, this is
Yeah, I heard the other day where somebody was talking about something that they read that said if you take, if you get this vaccination, that the melanin in your skin
I
is
heard
going to
that one.
change your skin color, and you know I know that when this virus first hit, and you know we're almost up on a year now. Here come February. So February and March of last year is when we started to notice that something was going on. And I was worried. You were worried. Well, okay, we're going to wait. Trump looked like he had something to do with vaccine, and we didn't want anything to do with anything he touched.
Yeah.
You know. But I knew I wanted to wait until a whole lot of people got that vaccine first before I lined up. And I know you and I had been talking about this for several months. And Marion, we don't have a choice. And that's what we began to realize after, you know, it's been more
What
than
else you gonna
800,000. You know, you don't have a
Either
choice.
you catch the virus, and it's a slow sometime process of taking you out of here, or you take the vaccine and stay alive. You know,
And that's the choice we have
you
right
know,
now.
Come on, use your brains.
you
One
know-
thing the Lord gave you was some brains, not for it to sit up there and for you to constantly scratch your head and all that stuff like I be doing all the time.
You know,
But use your brains.
there's enough scientific information out here now where you can make a decision about whether or not you're going to take the vaccine or not. So, caller, you are the first caller of the day. Thank you for being patient, and thank you for calling Ask Welfare Rights. Caller, you are on the air. Caller, you there?
We have some problems. You hear that?
That's not here. Caller, you on the air? Hello, caller, are you there? I don't know.
That's crazy. I can
Good morning, caller. You on the air?
Hello.
Yes. Good morning, caller. You are on the air.
Myself. Are you? I'm not. Wait a minute.
All right, now, caller, you have to listen to us. You have to listen to us on the phone and turn your TV volume down. So listen to us on the phone. Otherwise, you'll get that
Hello?
feedback. Can you hear?
How are you this morning?
Caller, can you hear me?
I need to mute.
Caller, can you hear me?
Okay. Oh, that's what it is. I thought I had to turn. Okay. I got that.
All right.
Okay.
All right. Well, good morning, caller. We were just having a brief conversation about this vaccine, and we're going to pick up that conversation after we talk with you first. I understand you were in a meeting the other day, and a conversation was held in terms of some of the benefits that are available to Highland Park. So would you please bring us all up to date? Tell us what you know.
You know what? Did I mute correctly? I'm having a senior moment this morning, and I'm not sure if you can hear me or not.
We can hear you.
And there's no echo because I did mute my phone.
Okay, now.
My television.
Okay, caller, all you have to do is to mute your television sound. Can you still see Marion and I on your screen?
I can see you, but I'm listening to you from my phone for some reason.
And that's correct.
okay.
That's what you have to do. Yes.
I got it.
Oh.
It's as if I'm a first-time caller.
Well, you are a first-time caller after about 2,000 other calls, but your first time today. Okay, so yeah, listen to us on the phone, and there's no echo and there's no delay on the phone. So we're talking directly to you right now, okay?
Okay.
All right,
thank
now what about this event, this virtual meeting you and Linda was on the other day, Marion, whoever else? Tell us what you know.
Okay. Now, you were talking about the vaccine, and Maureen, you had given me suggestions about how I could possibly find out if, like, who's giving vaccines out in Highland Park. And so I just wanted the neighbors to know that I spoke to the SAY clinic, and they said they had been approved for testing in Highland Park. Now, the SAY clinic is the clinic on Glendale by the old high school. It's on Glendale and 2nd. So they will be giving out free vaccines. And I also called the...
Well, what's the process? How does that, how do Highland Park residents?
They're going to have to announce it because they
Okay.
haven't received any of the vaccine yet.
Okay, but they haven't set up a protocol on how to get on the list either yet, have they?
No.
Okay.
I imagine that people would have to just call the telephone number and see.
Okay, Miss Gracie, Miss Linda, and Miss Marion, don't assume that. Get right on them, put both feet on their neck, and just, talk about what are the specifics. How do residents in Highland Park get on that list? So don't wait for them. Be a part of that conversation, okay?
Okay.
All right.
Yeah.
All right,
'Cause
go ahead.
because I did not ask that. So I'll call back and I'll ask that, how people can they sign up now for that? The other thing
One
was,
other thing, Gracie,
I called
can she hear me?
Hamtramck Health Department.
Miss Gracie,
Service Highland Park.
Miss Gracie, can you hear Marion? Say something.
Hello?
I
Gracie?
beg your pardon?
Gracie?
Yes.
Okay, just one thing on the once you call back and find out information, make sure you find out do they have to live in Highland Park, because that has come up several times in Detroit. Do you have to live in Detroit? So
Well, the SAY clinic, I did ask them about
okay.
Highland Park because that's where they are. They're located in Highland Park. So
Uh-huh.
I asked them if they would be providing vaccines for Highland Park residents.
Mm-hmm.
Now, when I called Hamtramck, they said no, they don't take care of Highland Park. But they gave me, they told me call Wayne County and see how,
That's what I want to report on.
where Highland Parkers can get the vaccine. So when I
I know.
called Wayne County,
I know. I heard it. But I'm
and that number,
I want to say something about it.
did you want me to give the Wayne County number?
Yeah, you
Yeah.
can give the Wayne County number now, and we'll ask you to repeat it again.
Okay, it's 734
Mm-hmm.
287 7870.
Say it again.
Let me put that down in this.
734
No, I got it.
287 7870.
Okay.
And,
Alrighty.
I was told that by Wayne County that Highland Park seniors and those 65 and older can sign up. They can register at Myers to get a free vaccine. That was the closest place to us.
So we're
Other
talking
than
about
that,
the
they would have
Myers
to go
on
to, Wayne County Hospital. Now the Myers on 8 Mile.
8 Mile of Woodward.
Yeah. Now, or other than that, they'd have to go to a Wayne County hospital. Beaumont, Detroit Medical Center, Henry Ford, St. John's Ascension, St. Joseph Mercy in Livonia, Trinity Health, and Garden City. Now, going to one of those hospitals, you run into the problem of not having transportation.
That's it. That's what I want.
Yeah, but that's
No,
that's not
yeah,
your
that's-
biggest problem.
If you call Wayne County, they will tell you, about the hospitals that you could possibly go to.
Yeah, but Miss Gracie, that's not the biggest problem. The biggest problem now, and until we nail down that clinic on Glendale and Second, what the situation is that you cannot walk up into a hospital and try to get on a list or try to get a shot. Marion
No,
had to go to the
no.
hospital the other day. This is an appointment only circumstance right now. So
That's
you have
right.
to make an appointment, and I'm not sure that the ages have changed, 65 and older, to get down to the TCF Bank downtown. But and I'm also not sure. I was told this, but I didn't check myself, and maybe you'll know. You don't have to be a Detroit resident to go to Cobo Hall now. I don't know. I was told that, but I haven't checked it out on my own. But go ahead,
Oh.
Miss Gracie. Go ahead.
Oh, no, so I didn't know that because I thought you definitely had to be a Detroit resident. Now,
All right.
that would be helpful if Highland Parkers can go down to the TCS, but I don't know because
I don't know yet.
yeah.
Yeah.
They're going to have to do a lot of folks going to have to call those different numbers and find out what are the criteria is to be, because I thought, because I was at Henry Ford Hospital, that they
On the
would
boulevard.
and which you are also, that it would be an automatic thing that they would be taking in their patients and you have to go through, you have to call some, one of the people told me I had to call my doctor and find out from her. Well, I went further, calling other folks and stuff like that. Then all of a sudden, looked like raindrops came down from Maureen and I. We had to be at the church,
We'll tell them. But
you
let
know.
Gracie.
But
All right. So go ahead, Gracie, and tell us the rest of what you heard, because
Okay.
yeah.
Just in terms of what Maureen was just saying, I know my doctor's office sent me a text, and I can't make an appointment from the doctor. What they told me is they sent me an application to fill out a survey, and so I was told that I'm on a list, and as soon as they get enough vaccines, they don't have enough now, that they would call me
That's the issue.
when it was my turn to get the vaccine. And I'm 72 now, so I'm within that age where I'm supposed to be one of the first in line to get that vaccine.
All right. Well,
Miss
now.
Gracie,
Oh, go ahead, Mary.
are you within the age range to be able to get that? Did they ask you how
No,
old
I'm
you were?
on a list. That's what they told me. They don't
doctor
have
said
it.
it.
I
Okay.
filled out the survey, and they told me they would notify me when my turn came up.
And also remember that if I had to take my grandmother Maureen down there, she will be able to get a shot at the same time, because she had to drive. I had to drive her down
Talking
there.
about TCF.
Yeah, I had to drive her down there and that type of stuff.
But
But
Miss Gracie.
you didn't tell them you were from Highland Park.
No, Mary's
that's a
talking about
different
something
thing.
else.
That's a
No,
different
Mary's
thing.
talking about something else. But go ahead, Miss Gracie,
but no,
because
there's
we're down to
alrighty.
10:30, ladies. Come on now.
Now
So
wait a
that's
minute,
about
Maureen.
all I
This is
know about
important.
the health so far. But I did want to talk to you about a program that's going on in Highland, that will be starting
Okay,
in
good.
Highland Park. About, I guess it's been about 5 years ago when that the Highland Park Human Rights Coalition brought a lawsuit against Highland Park, and it was settled. And so now Highland Park has actually, Highland Park actually has a income affordability plan that they can enter into with the water department in order to, which is based on their income, so that they don't have to wait until their water is being threatened shut off. They can enter into it before that, since it's a water affordability plan and it's based on the income. Plus, there's a really there are many steps that residents who are threatened with shutoff. There are many steps they can go through with the water department in order to avoid shutoffs. So, I just wanted to remind people in case they didn't know that. The water department did send a notice in the 1st of January with the water bill. But when we were in a meeting with the Human Rights Coalition, and we said, dang, this brochure, the type is so small, it's hard for people to read. And so we suggested to them that they print out something that talks about the income-based payment plan separate from the steps people have to take to actually enter into a payment plan, because it makes it seem as if, it's not broken up in a way that people will understand that they don't have to actually be in the middle of a shutoff in order to enter into a payment plan. So we suggested that they, do a different brochure and make it bigger, so the type bigger so people can see it. The other thing I want to tell you about, and we had mentioned this before, I know when I was on the call with Marion, that we have a water pilot program. It's actually a water leak and energy conservation pilot. The Highland Park Human Rights Coalition and Welfare Rights Coalition and the city, Highland Park City Council are the partners, along with MCA, which is the organization that runs, that hands out our bills and basically it's the water department in Highland Park. Metro Consulting Associates. They're not actually the water department, but they do the billing, so they're the water department. So the pilot is a state-sponsored pilot, and we're going to be starting the Human Rights Coalition. Well, we're going to start canvassing the neighborhoods. Now, there's a target first that we're going to look at. The water department has identified 100 homes that have, large water bills. And so it suggests that there must be some kind of leak in the home. So with these homes, the first group of people that we're going to target getting the repairs on their pipes and water fixtures are people that are 65 and older, the seniors. And seniors also who have children, who are taking care of children or who have children in the home, or they're, the grandkids are visiting. But that's the first group. Then we're going to start adding on other people. We're hoping to also include the disabled people in Highland Park, in that first group. Now, again, the target is 100 homes, which is small, but we're hoping that after that, there's, going to be a larger number of homes that can have their water pipes fixed and also their appliances, like their faucets and things like that replaced.
Okay, all right.
Another part of this project is that the Department of Health and Human Services, they're interested in helping people. There's quite a bit of money that they have to help people who have children make repairs on their home to avoid kids from becoming increasingly hurt by lead. You know how children will eat paint,
lead paint,
that falls, those chips and things like that. And so they have quite a bit of money. They will paint and make a lot of repairs to a home. In fact, they'll do inside and out in order to, help people who have, those problems with lead and they have children. So, we're looking forward to getting started with this pilot. And again, we want to, get it expanded after, the pilot is evaluated, it's possible for, it to be expanded to include a lot of homes because we know that there are so many homes in Highland Park that are in disrepair.
All right, Miss Gracie, can we depend on you to perhaps call in next Friday with additional information about this pilot program, especially when it might start and what is the phone number that people can call to get on the list, especially if they're being considered for the first 100 households. So will you continue to update us about this?
I sure will. And right now, I know they'll be able to. We'll be hanging out door hangers pretty soon. Yeah. But they'll be able to call Welfare Rights telephone number right now because the Human Rights Coalition, we don't have a telephone number. So, but they will be able. There's a state number and the water department number that right now that they'll be able to call. But we want to, make sure that they can get in touch with somebody from the Human Rights Coalition or Welfare Rights because we're a little bit more sensitive and helpful to people, who have questions.
Thank you very much, Ms. Gracie. We'll make certain that we remind you that next Friday you should be calling in again so we can get some, say it again?
Drink your coffee beforehand.
No, we don't want you to drink your coffee. We want you to mute your TV and listen on the phone. That's what we want you to do.
Good report, Grace.
Yeah, I just have to remember that. No, you might have to remind me because,
don't worry, we'll be on you.
I'm just not as sharp as I used to be.
Not a problem.
I just can't remember things as well. The order in which you actually do things.
Not a problem. Not a problem at all. We'll remind you and make certain that we'll get you on target. Thank you, Ms. Gracie, for sharing information. All right. Thank you, ma'am.
Maureen,
yes, ma'am.
Person who's our chairman of the Human Rights Coalition is Linda Wheeler. So it'll be one of us who calls in next week.
Okay.
And don't worry.
Thank you, ma'am.
This is a good club to be into.
All right. Thank you, ma'am.
And we really appreciate, you and this radio station because this helps us get the word out to the community.
Very good. All right. Thank you, ma'am. We'll talk back at you soon.
Okay. Thank you.
All right. Thank you much. All right.
Thanks, Gracie.
All right. So we've got some information. It's a wonderful pilot program that's on the way. And those of you that heard it this morning, and the program is going to be repeated a couple of times, make certain that you hear and understand this. And this is money that's dedicated, Marion, to Highland Park.
Mm-hmm.
So Highland Park residents are going to be able to get some of this money, and it's not a loan. Going to be able to get some of these services is what I mean. Mm-hmm. And so as we go further into February, we'll get that number. We'll be able to share what's going on.
But I want to say, one thing about this program, too, is that I'm appreciative. Highland Parkers got to have some respect for welfare rights because we've been working on this how long?
I'm getting ready to talk about it in a few minutes.
A long time. Please go and get that services. We fought to get it there and expose the fact that there's how can we work with what's the name of the group? I just forgot.
Wayne Metro?
Wayne Metro, to make sure that Highland Park is being serviced. And I'm glad that we met Miss Michelle who wants to work with us, who's head of that department now, because in the past we haven't had any good service, Maureen, since the young lady that used to work there a long time ago. So I'm grateful that they said that they're gonna work with us, and as well as we're looking for more funds to make sure we got a lot of stuff to do in Highland Park. We got a lot of stuff to do in Detroit because this is money coming from the feds, and it should be implemented for what it said that we wrote for it about.
All right, we're going to get that, and we're going to get the details, and we'll make certain that over the next few Fridays, we share that information.
Yes, we will.
So, all right, let's get back to this conversation about the vaccine. Okay, and all of these rumors, there's something online that says a lot of people who are getting the vaccination come down with something called Bell's palsy. And it looks like you had a stroke. Part of your face might be drooping, and that was an issue. And of course, everybody heard that. No, we don't want the vaccine. And then there were other things that are
these
online.
scientists that said that?
No, this is stuff that's online, and that's what I'm talking about. See, all those things that show up online, and all those things that show up on your cell phone, doesn't mean that it's true. It's all kind of crazy stories. And Marion had started to talk about we need to get our understanding and our information from science and from medical specialists. And that means you call your doctor. Dr. So-and-so, I heard that if you get the vaccine that you could develop colon cancer, or you could develop Bell's palsy, and your face will start to droop, and you could develop, and all those kinds of things. Ask your doctor. Ask your doctor. If you don't have a doctor, somewhere in your family, you've got a doctor or a nurse. Ask somebody that has some medical information. Go ahead, Marion.
Just going to the doctor myself the other day, I found out, and see, Maureen and I have worked to the point that we don't keep a secret. If they got it out there and it's for the benefit
tell
of
everybody.
we tell everybody. And the young doctor said, Mrs. Kramer, you haven't had a colonoscopy in, my God, in 10 years. I said, nobody told me I had to come right back, and how many years. And so he said, don't worry, we setting you up for one. We didn't know that. That's like when I had that, what did I have in my head? Aneurysm. We didn't know. But once you began to find out, go on and get yourself together.
All right, so what happened the other day, and we'll say this, and then I got a piece of history to share.
Well, before you said it, did you know you have to have a colonoscopy every 10 years?
Yes, I knew, and I knew that when I was sitting in your hospital room at the foot of your bed in the middle of the night, when the nurse came in and said, Miss Crane woke you up and asked you, were you okay, and that they just discovered on your chart that you had an aneurysm. I was there that day.
Yes,
so I knew then. I did know, and read up on what an aneurysm is,
and told
you
people
had
to go
to
in.
tell everybody about it. And you are the one that started on this very station, telling people when you go in for hospital checkups and whatever, you broke an arm and you roller skating and you fell and broke something, to have the physicians check for aneurysms. And I used to ask you, well, Mary, why are you saying that? And it's because of that incident that happened. Had that not happened, and you're still sleepy, and I'm sitting in the room, and the lady says aneurysm, we would not have been able to know that that's something we need to ask about.
And that if your sister had an aneurysm,
you
check
check
too.
That's what should happen. So quickly, the other day, I was in welfare rights by 12:30, working on some cases. That was Tuesday. And NOAH is the homeless project that goes on in Central Church.
Yes.
At our church, we feed people, housing and social services, the whole 9 yards. Happens every day, all day. And except for Fridays and weekends, Monday through Thursday. Say it like that.
But people seem to know where we are.
Yeah. So I came in, and that was Tuesday, went upstairs, and, about to work on a couple of cases I'm still dealing with. And the staff called me downstairs and said, look, we've got a lot of no-shows. A lot of people signed up to get the vaccine, and they're not here, and the project is going to close at 2 o'clock. And it was like 12:30. And they asked me, if you want to, if you haven't already had it, come downstairs and get your vaccine. So what did I do? I went and picked up the phone quick. Marion, come, we both members of this church. Come on down here, and I explained what happened. And, of course, here's Marion. No, I got a meeting to go to. Look, that meeting can wait. This is more important that we get this vaccine. And I know Marion and I both had been calling around, trying to find places. It was Gracie that helped us figure out, certainly me, that there was no place in Highland Park or Hamtramck. I didn't know that till she brought it up. So long and short, Marion finally got down there, and we had to hurry up and snatch her coat off, and I'm filling out the application because they about ready to go, and both of us got our vaccine. Now, let me just ask you a few questions, Marion. Did your face fall off after you got the shot?
No, I got right back in the car after I had to sit down. Just
Too
for-
much information.
for
Just say
15
yes or no.
minutes.
Just say
for
yes or no.
15 minutes and came back.
Everybody
with nothing.
has to wait 15 minutes
Yes,
to make sure you
yes.
don't have
Don't
an
be
allergic
like me,
reaction.
want to try to get out of
You
it
know,
because you can
it's
fall
been
out.
5 minutes. Can I go? No. All right.
Uh-huh.
Did any of your
Very-
skin color go away?
No.
Well, just say no in the microphone.
no.
so I
You hear me?
All right. Did your hair fall out?
Hecky no.
All righty. Did you lose a arm or a leg?
No.
Okay. Were you dizzy at any time?
No.
Okay. Did your digestive situation change?
No, Mo.
I'm just telling you about stuff
I looked
that I've
in the
heard.
mirror and my face hadn't changed.
You know, well, I'm talking about digestion.
Yeah,
I'm
I
talking
want
about
you to-
inside.
Yeah, okay.
And the last thing I'll ask you didn't develop any Bell's palsy. None of that happened. Now, with me, I didn't have any side effects at all. My sister told me that the next day you might feel a little discomfort, a little sore,
Yes, what Jackie
just
told me,
where the shot was. And I did have that, maybe about the size of a grapefruit. I felt a little bit of discomfort, a little sore, but that would be the same with a flu shot
Yeah.
and any other shot. So that was that night. The next day, I probably had it again, a little sore, but I didn't notice it. Nothing stopped. I kept on going. So the point that Marion was raising earlier, because in America, Americans don't have any discipline. They will not wear a mask. And I'm Exhibit A today. Had my mask in my hand, bringing it into the station, and stuck it on the seat, and walked right in here and left it in the car.
we tend to
And I never do that, but don't follow my example. Keep your mask. Keep your mask on all the time. And I didn't even think about it. Didn't even think about it. So I want to say this. Next time Carolyn orders a face
we gonna
mask.
order?
No, what I'm saying is let's try to get the color on the inside not to be white because it ruins our special colored lipstick.
Oh, shit.
And that's what happened. Now, with that,
Oh, Lord have mercy.
all right, I found this. I didn't even dust it off.
What is it?
And I try to bring it out every so often.
Got dust on it? What's wrong with
Oh,
it?
it's in the basement.
Oh.
All right. Now you can't see this. The print is too small. And what this is a blown up copy. Don't touch it because it's got dust on it, and I don't want
Okay.
you sneezing. And what it is a blown up copy of the application for state emergency relief. This is, I blew it up and we filled it out because we were going to talk about, Marion and I, on this particular broadcast, the first year we started. We were going to talk about how you complete a state emergency relief application. Your name, your case number, the ID number, and Marion, what's the date?
5-1, what is that, 103?
03.
Uh-huh.
Marion and I have been coming down here since 2003. This is 2000, that's what I'm saying, 2021 now. So we've been coming down here for 18 years. 18 years. Marion, come out of that trance. 18 years. And we wanted to show this is the first thing. Look at the dust all over because I keep it in the basement. I got behind on my utilities because I got tricked into work first.
Oh, yeah.
Found a job.
Oh, my God,
I
yeah.
paid too little and the bill grew. And FIA, at that time it was Family Independence Agency, wouldn't help me again when I asked. And now that I'm working, I can't afford the high bills. And we had all of the information, your name, the family member's name, how much money you got, all of this, and the date on the back, May 1st, 2003.
And that's coming up soon.
And just wanted you to know, you know, for 18 years, Marion and I have been coming down to this radio station trying to serve this community, explaining why the state emergency relief is important. And it is today. If you want some help with the delinquent light bill, gas bill, water bill, burial funds, back taxes, we keep saying the
The
same
money is
information.
there for you.
Call Wayne Metro, area code 313. The number is 388-9799. 388-9799. I talked with Marion the other day where we
Which
got
day?
this well, let me tell you the incident. We've got this senior that calls every year to get
Oh,
some
my
help
God,
with
yeah.
her son's DTE bill. And she's never joined welfare rights. It's $30 a year to become a member of our union.
Just to keep the phone
Just
on.
to keep the phones on. That's all we use the money for because all of us are volunteers. And she called on the phone the other day. And I put her on hold and went back and found the first time we're pack rats. We don't throw anything away. And went back in our but our old files and found her name. The first time she called us was in 2011. It's coming on 10 years. And she has never joined welfare rights. And always, I need some help. My son is behind, my uncle's behind, my daughter's behind. So I went back to the phone and I reminded her, you've never joined welfare rights. And we keep, over the years and years and years, helping you to get out of trouble with a light bill, a gas bill, and all the rest of these things. And what she say, Marion? Oh, I know, but I was intending to pay just tomorrow. Yeah, okay.
No.
So, put her on hold again. Got my colleague, Pat, told Pat what was going on. And we can't do any more services for this lady. We can refer her to, a lot of places. But she has to go and manage it on her own. And before I left the office, Miss Pat was writing up a case. And I snatched it from her and tore it up. You have to become a member of welfare rights in 2021. If your lights are about to be cut off, your gas and your water, not the water, because the water's going to be on till 2021. But all these things are going on, and you're not a member of the organization. If you tell us we're going to send in our membership check tomorrow, the next day, whatever it is, I'm going to tell you I don't care if your stuff get turned off. I don't. If you're not willing to make a contribution to welfare rights to help keep the phones on for not just you but for everybody else, I don't care. You don't join, you don't pay your membership dues, and none of that West Side Mothers stuff. You pay $3 and then we'll worry about the next $3 next month. No.
No,
You're
we
smoking cigarettes, you drinking wine, a beer every other hour. Pay your membership dues.
Not only that, Maureen, the church has been having their door open for people from welfare rights for years. First it was Reverend Ed Rowe, and now it's Lord, Jill,
Now,
yeah.
what does that have to do with?
Now, and I'm saying that we have to pay for certain things ourselves in order to keep our organization running for your benefit. But yet and still, it's same thing with the station. Yet and still, you want to be able, you want to
tune in to this station.
You want us to jump back and do for you, which we have always done. You need to get up, make this a different year.
And donations to welfare rights, certainly donations to this a wonderful station that continues to keep the lines open. They're going to be critical. I found out, and Navarre called me about this, all of the Lord and Taylor stores in America are closing. So all of those people that were working there, all of them out of work.
Every day,
Every day.
every day, some
single day.
institution is closing.
Yeah, so this COVID is just taking its toll. But these corporations, I saw were my favorite
Honey,
chocolate group,
You see how much
Godiva.
money they get?
Well, wait a minute. Godiva's closing all of their Godiva chocolate stores and they little boutiques that always was in the mall. And Marion, they're closing all of them. And it's because there's no foot traffic. Nobody's going to the mall. We're not scared to go in and buy anything. So these workers are being laid off and they're being separated from work. And thank God we've got Big Gretch, who is now making it possible for workers to get unemployment benefits and $300 per week. $300 a week, so $1,200 in a month plus whatever your unemployment benefit is. So you should go in and do that. You should go ahead and get involved. And there's nothing wrong with you sending a money order. No personal checks. I know you guys. There's too much of that
Oh,
bouncing.
do we know you?
Yeah, no personal checks, but sending a money order down to Welfare Rights for $30 and make certain that your name is on there.
For a year.
And at $30 for a year. And your phone number, you can write your phone number on a money order and somebody will call you back and we'll tell you, because we still doing COVID too. We'll call you back and tell you that we got it and we'll write up your case and figure out what's wrong right over the phone. So you have to become a member.
I'll tell you one quick example, and I know because we're coming to an
2
end.
minutes.
And that is, years ago, a lady came into our office, and she had also started taking care of her sister who had passed away, children, plus her children, which ended up being 11 children. And by the time Welfare Rights got through with it, and she had been going to the welfare department trying to get help with that, by the time we got through with that, that woman got back payment of food stamps for 4 years, Maureen. 4 years.
Those were the old days.
Yeah, but that don't
How
negate
far
the
can
fact.
you go back now?
We will find out, but that don't negate the fact that Welfare Rights is out there for folks.
Have been all this time, and I mean the reason I brought this up is because I found this document. So since 2000, we had already been on the air for a while, and we were wanting to do a special tribute to try to make certain a special education. Now listen, you got 30 seconds to say goodbye.
Well, we had death again in Highland Park, Mama Shu's son, and we want to, not only send out prayer and stuff for her, but also to, people should, when you can, check on her family, and that's right here in Highland Park. She is Maureen, she works in everything around here. She's a minister and everything, and our heart go out to her.
All right, Mary, say goodbye. We have just a few seconds left.
I'm not saying goodbye. I'm saying see you next week.
Okay. All right, this is good. Annual broadcast of Welfare Rights, and it is annual because this is a new year. It's January. A few more days it'll be Black History. The number to Welfare Rights is always the same, 313-964-0618, 313-964-0618. Call us, leave us a message. We're working on phones to make them act right, and we're still in
Yes.
COVID at our office, and we have staff coming in at different times so that we can be extra careful. But so far, so good. To our Miss Denise, our hairdresser,
Oh,
be
please.
careful, be safe, and for everybody else, wear your mask, follow the rules,
Yes, hear
and
that.
go get that shot. Go get it. Downtown at the TCF building, the number is 313-230-0505. 230-0505. All right, I'm on my way to my job. I'm going out to Detroit Community Schools right now. So if you need me, call me down there, and I'm not going to answer the phone because it's way in the back, and I have to pass people, so I'm not going there. Call us at Welfare Rights. Mary, say goodbye.
Goodbye. Have a wonderful weekend.
Goodbye.
There's a new financial empowerment center located in the Wayne County Treasurer's Office on the 5th floor of 400 Monroe in Detroit.
If you or someone you know needs help with their finances, budgeting, and making monthly payments, the Detroit Financial Empowerment Center can help.
Wayne Metro Community Action Agency has counselors ready to provide free one-on-one counseling to help you address issues related to utility bills, taxes, and other financial matters. We can also help you improve your credit score.